আমি ডাক্তার মঞ্জুর শওকত এই মুহূর্তে দাঁড়িয়ে আছি ব্রিটিশ সাম্রাজ্যের প্রাণকেন্দ্র ব্রিটিশ পার্লামেন্ট ওয়েস্টমিনিস্টারে। একটা সময় ছিল যখন একজন অভিজ্ঞ বিশেষজ্ঞ চিকিৎসকের পরামর্শের জন্য আমাদেরকে এক দেশ থেকে আরেক দেশে ছুটে বেড়ানো লাগতো। এই পরামর্শটুকু নেবার জন্য অনেকের যোগাযোগ হয়তোবা সামর্থ্য অথবা সময়ও ছিল না। ব্রিটেন, আয়ারল্যান্ড, ইউরোপের বিভিন্ন দেশ, যুক্তরাষ্ট্র, অস্ট্রেলিয়া, কানাডা সহ পৃথিবীর বিভিন্ন দেশে বাংলাদেশের ডাক্তাররা কাজ করছে সম্মানের সাথে, উঁচু করছে দেশের ভাবমূর্তি। তার পাশাপাশি রয়েছে গ্রাউন্ড ব্রেকিং রিসার্চের সাথে সম্পৃক্ত। ঢাকা, চট্টগ্রাম, সিলেট, নোয়াখালী, কলকাতা, সিডনি, টরন্টো, নিউ ইয়র্ক, লন্ডন, আপনি পৃথিবীর যে প্রান্তেই থাকুন, ওয়ার্ল্ড ক্লাস এক্সপার্টের পরামর্শ পেতে পারবেন আমাদের মাধ্যমে। TV3 Health Advice is a live interactive program with world-class experts. আসুন ডিজিটালাইজেশনের এই সুযোগটাকে ইউজফুল করে তুলি। দেখুন TV3 বাংলা হেলথ অ্যাডভাইস ইন্টারেক্টিভ প্রোগ্রাম প্রতি রোববার ইউকে সময় বিকেল 5টায়, বাংলাদেশ সময় রাত 10টায় আর নিউ ইয়র্ক সময় দুপুর 12টায়।
Hello everyone, good evening. I'm Dr. Showkat. I'm from TV3 Bangla London studio, and today's show would be on dementia and delirium. And just telling a little bit about what is dementia and delirium. And this is, we may lose our memory, and forgetfulness is very common in our everyday life. It could be affected by some medication, or if you are stressed, or if you are too tired. But all this forgetfulness is not dementia. So we'd like to hear from the specialists who are dealing with dementia patient. And TV3 has invited two specialists, one on dementia specialist and another is delirium specialist. Let's introduce our guest speaker today. May I introduce very quickly to our one speaker, Beth Cotton. Beth is a dementia lead nurse in Doncaster NHS Trust. And thank you, Beth, joining us in TV3 Bangla show. And the huge commitment weekend, Sunday evening, you try to get engaged with the community, especially with Bangladeshi people. It's a very welcome from TV3 Bangla. I hope you will enjoy our program, and especially you might get phone call from our viewers who are watching. And viewers who are watching this program, you can see our phone number is TV3 Studio plus 44122739297. And Beth has been working long time who is dealing with dementia patient. We introduced when she was working for Imperial Healthcare NHS Trust. Then she moved to north of the country. So we have got another guest speaker today is Wragg. Julie is with patient with delirium. So we'd like to hear from what is delirium and what is dementia, how actually we can separate both these things. Obviously you are dealing and long experience, and I know you are also patient-centered care practitioner.
That's right.
To hear from your work, what kind of activities you are involved with your patient, are we actually helping your patient to get better? So very welcome to TV3 Bangla studio, and is actually really glad from the community and especially from Bangladeshi people to having with you with us today's show. Thank you very much, Julie. Let us start with Beth. Dementia is such a common problem in this country. Around 850,000 people are affected by dementia, is according to research. And 1 in 14 over 65 are affected by dementia. 1 in 6 people are affected, over 80 are affected by dementia. I can see that from the research, it's a huge problem. And can you just very briefly tell our viewers, what is dementia? What does it mean? Because I mentioned already, our memory can affected by stress, medicine, or drugs. When it is not at the normal memory loss, you say is dementia.
Yeah, so dementia is a term that we use for ongoing decline of brain function, and it's basically damage to the brain, and that damage interferes with the brain cells' ability to communicate with each other. And when brain cells can't communicate with each other, we see changes in a person's thinking, their behavior, and their abilities. Everything that the brain can control changes when someone has dementia. So it is, as you say, much more than the forgetfulness that we can all experience. So with dementia, we will see sometimes changes in a person's memory, difficulty in performing everyday tasks, such as things like making a cup of tea, leaving your keys in the front door, putting the gas on your cooker, becoming disorientated in familiar spaces as well as new spaces. Forgetting words, so it might be saying the wrong word or saying a different word, not saying the right word and saying a sound instead of words, making strange decisions, so not understanding the consequences of your actions, and changes to your personality and behaviour. And as I said, it's damage to the brain, and the brain controls the rest of your body. So if the brain starts to change, then the rest of your body will change as well. So we might start seeing things like people walking into things, bumping furniture, falling over. The appetite could change, the coordination, so they've been able to get your clothes on, being able to find your way around places, chewing, swallowing, lots of different things can change. And not one person not will experience things in the same way as everyone else. It's a lot of information to give people with dementia. So one of the things that we talk about it in a simple way is that it's brain damage that changes the way that you think and do things.
So what you said is a brain damage is obviously is an organic disorder. It's
Yeah.
nothing functional.
Yeah. And
Condition I mentioned.
yeah,
Go on.
sorry. Often it is dementia is seen by mental health services, and that's always been historically that's how we've dealt with things. But it is very much a physical condition, and it's something that we should all be concerned with.
Thank you very much for very clear explanation of what the condition is. Let's hear from Julie. Julie, delirium is another common problem. It's among the elderly people with 65 years, or even things you get more common in 80 plus people. What is delirium? We heard from Betty's dementia.
So with delirium, it's a much more sudden, acute confusion. Sometimes it can be mistaken for dementia, but one of the easiest ways to determine between the two is just to simply ask, is the patient more confused lately? Is this person suddenly confused? It's not a gradual thing. It can happen very quickly. And often it can be as a result of an illness, usually infection, but not always. Having surgery, a change of environment. Sometimes it can be the patient is very distressed because they've had a bereavement or a death in the family. And sometimes it can also be because of medications as well that the person has been started on. Sometimes those medications can have an effect on the person that's taking them, but also if they're taking a number of medications, they can interact with each other and cause that confusion. But the thing with delirium is it actually starts very quickly and very suddenly. And it can be really frightening for both the person that's experiencing it, but also for the people around them, because the change in them is very quick, and it can be very frightening. The person also can sometimes have a very quiet delirium, so they can be very lethargic, very sleepy, just muddled, and it's not very clear. But also they can be very loud, very shouting, and saying lots of confused things, and that's much more clear. But either of those things can be delirium, and it's important that it's seen and recognised quickly.
Thank you very much. From your explanation, what I understood is delirium is much more of acute events than
That's right.
early dementia. Dementia is much more progressive disease.
That's right.
Just wondering, which age groups are more commonly affected by delirium?
The thing with delirium is, although it does tend to affect older people, it can actually affect anybody at any time. So it's really important to recognise that just because somebody's younger or they're very fit and healthy, it doesn't exclude them from them ever being able to get delirium. So if somebody that you know, regardless of what age they are, it suddenly becomes very confused, it's important that they're seen by a doctor very quickly so that they can help support them through that delirium and find out what it is that's causing it.
Thank you. Thank you very much for a very clear explanation. Let's talk to Beth again. Beth, you was saying about details about dementia. What are the common symptoms patient may present with when you see patient in hospital?
Well, one of the first things that people think of when they think of dementia is forgetfulness and repetition, but actually not all dementias will present this way. So one of the things that we start looking at is a person's functional ability. So what things can't they do anymore? So it might be things like not managing the finances properly, or forgetting to take medication, or it could be things like putting things in the wrong place at home, forgetting how to drive. We also see changes to a person's behaviour, so they might become more irritable, snappy, start doing and saying things that they wouldn't normally do. And that can be quite bizarre things, so shouting out at people. We sometimes see people becoming racist when they weren't previously, or sexually disinhibited, so start saying rude things. We can see changes to a person's judgment as well. And sometimes it can move to more of a loss of initiative to do things, so not wanting to do things anymore, and the person might seem quite depressed. But it's like a lack of motivation to do things. There's also, we'll see difficulty in, as you've said, about the time and space as well. So knowing where you are, knowing where things are, trying to find your way around in a new environment, and familiar environments as well. So there's lots of different things, more than just the forgetfulness, that we need to be aware of. And what we often see as well is that different dementias can present with different symptoms. Sorry.
Kind of dementia. Just before that, can I just quickly speak to Julie about symptoms of delirium? Julie, I think probably you have already heard Beth was explaining the common symptom. Is there any symptoms for somebody with delirium? Something confusion, or apart from confusion, is there any other things?
Yeah, sometimes. So some of the things that can cause the delirium are things like infection, being dehydrated or malnourished, being constipated, not being able to pass urine, having surgery or a hip fracture. Sometimes severe illnesses and even vision and hearing problems can all contribute to the delirium. But the most common symptom is the confusion, but all the other factors contribute to that. So it's really important to look at all the other things to make sure that everything else is okay and is in place, which will then help to reduce the confusion that person's experiencing. But the confusion that we sometimes see and recognise is not always just about getting your words muddled. It might be something like using the wrong cutlery to eat the food, or it might be speaking to a person that they know really well and recognising them, or it might be forgetting their way around somewhere that they're familiar with, not recognising objects as belonging to them. One of the most common things that we see with our patients in hospital is when visitors come to see them, they don't recognise their loved ones. They don't recognise their husbands or their wife or their son or daughter. So sometimes people who they know really well, they become confused and don't recognise who they are. And that can be obviously very distressing for those loved ones, because they're familiar with them and they don't understand why they're not being recognised. So the earlier it's seen, the earlier the delirium is sorted, and the quicker that those symptoms and the confusion can be reduced. But it's also really important to note that delirium can sometimes last for a very long time. So even after the illness or the medication problems or the cause of the delirium is sorted, the delirium itself can still sometimes last for quite a long time.
Thank you very much. Let's ask Beth about three things we have learned from the discussion. One is dementia, one is delirium, one is confusion, and also other thing is depression. Beth, if you can explain to our viewers who are watching this program today, how do you differentiate one from other, like delirium from dementia, dementia from confusion, confusion from depression? Are they interlinked or are they separate entity?
There is a lot of overlap in the three. You could call it like the 3Ds, so dementia, delirium, and depression, and they are some of the main kind of diagnoses that older people get when they're in hospital, and there is a lot of overlap. And one of the main things that we would be looking at is, as Julie said, the onset. So is it a slower onset? Is it quite insidious? Can you think of things that have happened building up to it? Think actually they did have a bit of an issue 2 years ago. I can see things were starting slowly. Or have they had a bereavement? Have things becoming quite difficult for them? Have they been quite stressed? Have they had something suddenly happen medically to them? So we'd be looking at the onset as a starting point, and then we might be looking at things like what other symptoms they have, like are they hallucinating? So sometimes with delirium, people can hallucinate. In very severe depression, psychotic depression, some people can hallucinate, but it's more often maybe like ruminations, so overthinking things in delirium, in depression, and in dementia. Hallucinations, so seeing things can happen, but what we often find is people misinterpreting information around them. So seeing a pattern on a wallpaper and thinking it might be a face or an animal crawling on there, or thinking that a picture might be looking at them. So it's misinterpreting the information around them. So it's these kind of things we might be looking at to try and differentiate what they all are.
Thank you very much for explaining and differentiating one from other. It's actually people, even the educated people, sometimes confused. And actually, you mentioned that is actually overlapped one with other. Dementia is such a big problem, not only for this country. Viewer who are watching internationally and around the world in Bangladesh origin, around 50 million people in the world are having dementia, is according to World Health Organization. And over 60% of these people are not from developed countries. Either they are from low income or they are from middle income country. So one of the messages I want to give through this program, do not think dementia is a psychiatric illness. As Beth mentioned, it is a disorder, it's a disease. Sometimes people actually, family members or friends get very disappointed or get irritated by seeing the symptom. You know, we have got different health condition. We treat as disease. So my request to the viewers, dementia is not something, it's a psychiatric issue. It is something, a health condition that could be affected by for many reasons. Let's go to again. We want to do different types of dementia. Beth, you're long extending this experience with dementia patient. Can you tell us, our viewers, what are the different kinds of dementia you find in your practice?
Well, the word dementia itself is not the end diagnosis. So dementia is an umbrella term. So there's over 100 different conditions that can cause dementia. And some of the ones you might have heard of. So Alzheimer's disease is the most common type of dementia. Around 2/3 of all people with dementia have Alzheimer's disease. We've got vascular dementia, Parkinson's disease, Huntington's, Korsakoff, which is alcohol-related dementia. Got frontotemporal, so which is affecting the front of the brain first. One thing that I wanted to mention in this section actually is around our perception of most people with dementia being old, and we can actually get dementia at any age. So you do get some childhood dementias as well. So you can get young people being diagnosed with dementia, people in their 20s and their 30s. It can happen at any time. So it's important to remember that when we're thinking of dementia and the types of dementia, we're not just relating it to it being an old person.
Let's say I would request our technical team whether they can show some nice picture you have actually sent to us, the umbrella picture, then people
Yeah.
have a better understanding if they can watch this umbrella. I would request our technical team to show this umbrella you have sent to us. They can show in any moment. So let's go on. So younger people can also get demented and they might have. So who are those young people actually, or unfortunately, having dementia? Is there any certain disease can turning into dementia or?
Yeah, so there's a type of dementia called Pick's-Nymans it can affect younger people, people under the age of 10, but people with Parkinson's disease, Huntington's, frontotemporal dementia is one that is often in younger people, and frontotemporal dementia is a dementia. It affects the front of the brain, which is responsible for our personality and our behaviour and our understanding of what's acceptable in society. So if someone's got that type of dementia, they will have big changes in their behaviour and their personality, more than what we might see to their memory. So sometimes we don't think it's dementia because the person doesn't have changes to their memory. So we don't think it's dementia. We might think it's a mental health problem or maybe a midlife crisis. So the diagnosis of dementia is delayed slightly, but we should always be thinking, is it dementia? Could we be see changes that are developing into dementia at any age?
Yeah, thank you very much. Let's talk to Julie again. So you mentioned about delirium. Is there any risk factors for delirium?
There's actually quite a lot of risk factors. The list is almost endless, but the most common ones that we tend to see are, although I've already said that it can affect any age, it does tend to be older people. Having an infection, being dehydrated and malnourished. So if somebody, we often find that older people tend to drink less because they don't want to have to keep getting up to go to the toilet because they're then at risk of falling. So they drink less, they then become dehydrated, and that can cause problems. Multiple medications. A lot of our older people are on lots of different tablets. And sometimes those medications can actually interact with each other and cause a problem. A lot of older people also tend to get hip fractures and have to have surgery. And we find that a lot of people that have had a hip fracture and have surgery do tend to develop a delirium after they've had that surgery. The environment changes as well. Sometimes if somebody's used to being in a particular environment and then suddenly they move to a different one, that can cause a lot of confusion and the delirium can develop. Having a severe illness, lack of sleep even can contribute. So we find sometimes that if somebody's struggling to sleep, they can develop the delirium, and then that actually affects their sleep even worse. So they tend to sleep through the day, they're awake all night. Being constipated, not being able to pass urine. And for people who tend to wear hearing aids and glasses, by not having those in place, something as simple as that can actually cause delirium as well.
Thank you very much. So what you are advising, people should have drink plenty of water and keep dehydrated all the time.
Absolutely.
And it actually people can get constipated and actually can turn into delirium. Very much. Did you find during this COVID-19 time, did you find anyone is presenting with delirium later on diagnosed as COVID positive in your hospital practice?
We have had people that have come in with COVID-19, and then as a result of that, they've gone on to develop pneumonia, and then because of the pneumonia, they've developed delirium. That's been quite a big problem. And one of the things we've found is trying to keep things as normal as possible, trying to keep the environment the same, trying to make sure that the patient is settled, they're eating and drinking, and that their bowels are opened regularly. The small things that we take for every day for granted, they're usually the things that help to resolve the delirium most quickly. So it's really important that the patient, whether they're in hospital or not, have a routine. And if people do develop with COVID-19 symptoms, the best place for them is at home because it's their environment and it's things that they're used to. However, if they do need hospital because the COVID symptoms are so great that they need hospital treatment, we do try to keep things as normal as possible for them. But I'm sure you can appreciate at the moment with COVID-19 that's just so difficult because we don't know enough about it to be able to do that. So catching early and treating earlier and minimising the risk factors are the most important thing for that.
Thank you. Thank you very much. Let's hear Beth's experience. Did you find during this time, at this pandemic time, did you find COVID patient had got dementia-like symptoms? Or
I've not seen anything about COVID like bringing on symptoms, but what we do know about COVID is that 25% of the deaths in the UK have been people with dementia. They have suffered quite badly during this pandemic, and it's been difficult to care for them whilst they've been in hospital because not having their loved ones with them has made things difficult, and it's gone on to lead to delirium because the loved ones aren't there to support them as much as they may have been before COVID-19.
So it is very scary that 25% of people died because of COVID. They got dementia.
25% of all deaths were dementia.
Do you think any particular reason for, or are they not looked after enough, or?
I think there are a few different reasons. Obviously, dementia causes frailty, so people with dementia will be more likely to die from some kind of severe illness. But it has been hard. It's been hard to look after people when they're in hospital and when they're in care homes as well, without their loved ones there to support them. Carers, family members, they take up a lot of a lot of kind of the slack. Yeah.
This is a very strong message for any relative or friend. They need to be a bit proactive during help their friend or family members, those who are having dementia. I think they need more care than it used to be in the normal time. I think this is really, really important because I did report that a huge number of people died because those who had dementia.
Yeah.
And probably this is not only part of government, it is actually helping or managing dementia is a part of family, specialist, government, and also family friends. Everyone's a job to help if somebody become dementic. Viewers who are watching this program, we are going to a short commercial break, and stay with us. We'll be joining you after the short commercial break.
دار الحديث لطيفية, an Islamic secondary school in East London.
أدرس في دار الحديث اللطيفية. أحب مدرستي لأني أتعلم.
Not only do we have the Islamic sciences, but we are also able to offer the national curriculum such as maths, English and science.
Rated good by Ofsted with outstanding behavior and attitudes, personal development and leadership and management.
The teachers at our school are very hardworking and caring, and there's always a positive, safe and secure atmosphere in and around our school.
Admissions are now ongoing. Secure a place today. Visit us at 1 Cornwall Avenue, London, E2.
Are you a first-time property buyer? Are you a homeowner looking to raise funds from your property? Are you looking for better mortgage deals? Look no further. Binaco Financial Services is the answer. From residential mortgage to commercial mortgage, Islamic mortgage, or limited company mortgage, we provide mortgage services that best suit your needs. Let us help you to find the right mortgage for you. Call us today on 0208 050 2478. For a better future awaits you. Binaco Financial Services Limited is directly authorized and regulated by the Financial Conduct Authority.
Good evening. We are back again. I'm Dr. Monjur. Showkat is from TV3 Bangla Health Advice. I'm anchoring this show from our London studio, and today we have got two guest speakers. One is dementia specialist, and other one is delirium specialist. Can I quickly introduce our guest in this segment, viewers, those who have joined this segment? I'm just quickly introduce Julie Wragg. She is a delirium specialist, and she is patient-centered care practitioner. They working in Doncaster NHS Trust, and we have got Beth Cotton. She is a delirium specialist, and she is lead nurse in same hospital, and have been working with so many years helping a patient with dementia. And she's dealing such a long experience from both of them. Our viewers already have got to know how they actually can present. We know about the symptoms. We know about the risk factors. Already, both of them actually mentioned us. Now, we want to know more about how we can help these people during this segment. We'll get to know. Just before starting prevention, let us start with delirium patient. Julie, how risk are the BAME communities are delirium? People
Sorry.
with BAME communities, Black, Asian, ethnic minorities, how risk they are?
So there isn't a lot of evidence to suggest that Black, Asian and minority ethnic groups are more at risk of delirium, or not really. However, it's really important to understand that delirium can affect anybody at any time, no matter their age or their ethnic background. And seeking medical attention early on and being aware of the risk factors of delirium is the most helpful thing that somebody can do for somebody, that recognizing that something's not quite right. Keeping fit and healthy and looking after yourself as well are probably the most important ways in which you can help keep delirium to a minimum and to reduce the risk of getting it. I think maybe one of the problems that may affect the BAME community a little bit more is that if they're less likely to seek help and support because they don't want to bother the doctor, or they don't want to, they might be embarrassed because of the confusion, then that perhaps may be a reason. But again, it's just so important to recognise that it can affect anybody at any time, at any point in their life, and to not just assume that it's older people.
Thank you very much. Now, get back to Beth about dementia and how common dementia among BAME communities. Is that very common? I know lots of people on ethnic background, Bangladeshis or Black, African or Caribbean people, they have got high blood pressure and lots of diabetes as chronic condition. How risk people with BAME background having dementia in future?
Well, as you said, there is more vascular risk factors. So there's higher risk of stroke, heart disease, and diabetes, which are all risk factors for dementia, in particular vascular dementia. In the UK, as you said, around 850,000 people have dementia, and looking specifically at the South Asian communities, there's around 5% of that is South Asian communities. There's not a lot of research going into BAME communities. There's been a couple more kind of research projects in the last couple of years. What we've found is that most people from BAME communities present later in their diagnosis. So they may have had dementia for a longer period of time before seeking support. And that's families supporting people at home for longer, not being as aware of what dementia is, so they don't go and seek the help and support that they need. There was some research a couple of years ago by the University of Bradford by Dr. Parveen, and it was called HOPE Caregiving Study, and it looked specifically at the experience of carers in caring for people with dementia. And what was found is that there's more a sense of obligation in caring for your loved one, and helping them, and not going and seeking support. there is another issue in the seeking support side, is that a lot of services are not kind of culturally aware enough to support people from BAME communities. So they're not accessible enough. So people aren't accessing the support even when it might be available out there. So a lot more research needs to be done on it, particularly around the risk factor side of it.
Thank you very much. And I think there are not many research going on, not only dementia among BAME communities health. There are lots to be done. I think people with the BAME origin doctors or nurses, that they should also come at the forefront to actually explore more, doing more research and help BAME people living in this country and around the world. So I just want to ask about, how do you minimize the risk factors for dementia? Any particular tips?
So there are some like modifiable risk factors. One thing that I just wanted to say about risk factors is you could have every risk factor and not develop dementia, or you could just have one or two of them and then go on to develop dementia, or you could have none and go on to develop dementia. They just increase or decrease your risk. Some of the things that have been helpful in possibly reducing your risk of developing dementia are being physically active. So what's good for your heart, your circulation and your weight and your mental well-being has been seen to be good in reducing your risk of dementia. So doing both aerobic exercise, such as a brisk walk, jogging, swimming, riding a bike, but also resistance exercises, such as going to the gym, push-ups, sit-ups, or digging in your garden. So a mixture of different exercises, and getting fresh air and being outside. Eating healthily, so having a balanced diet of fruit and vegetables and protein, and then limiting sugar and salt intake and trying to reduce your saturated fat. And as Julie mentioned earlier, for delirium, drinking plenty of fluids, so water, milk, or sugar-free drinks. Smoking as well is something that's been seen to increase your risk of developing both vascular and Alzheimer's disease. And it also leads to a risk of type 2 diabetes, strung lung and other cancers. Drinking less alcohol, so no more than like 14 units per week spread out over several days in that week. And it's also really important to exercise your mind. So there's very much kind of a thinking of use it or lose it. So keeping your brain active, learning new things, puzzles, crosswords, playing games, reading, and talking to people, joining a club, volunteer work, keeping yourself active. If you are worried about your risk, one thing to think is to go and see your GP, and that's whether you're worried about physical risk, or your mental health. If you're worried about how your mental health is impacting, please go and talk to your GP.
Thank you very much. You actually mentioned lots of things. That risk, minimizing risk. Actually, if people are more aware of the good health living, that also don't help dementia. It can help reducing other risk factors, like it can help preventing high blood pressure, can prevent heart disease, can prevent stroke, can prevent cancer. So I think the whole message is, if somebody really switch to live healthy, that can help not only one condition, can help multiple other conditions. And let's talk to Julie. Julie, and how you see our viewers are today's, most of them are Bangladeshi, and any particular advice for Bangladeshi people to minimize risk or keep them better from delirium?
Yeah, so one of the things that people struggle with is recognizing the difference between delirium and dementia, because they can sometimes overlap and be very similar. But often the ways to minimize those risks are very similar. So everything that Beth has just said is exactly the same for people that may experience delirium and reducing that risk. But again, it's things like eating healthily, making sure that you've got a balanced diet, drinking plenty of water, The things that we tend to take for granted are the things that are most important. Keeping a good routine, so trying to get up at the same time each day, going to bed at the same time, making sure that you're getting plenty of sleep, that classic 8 hours a night sleep, which I wish we all could manage. Treating infections and illnesses early, so not leaving it till the last minute before you go to the doctor. As soon as something becomes apparent that it's not quite right, making that visit to the GP sooner rather than later. The longer it's left, the more likely you are to go on to develop quite a severe delirium. Things very simple like wearing your hearing aids and your glasses, and trying to keep the environment the same. It sounds really strange, but actually, if somebody's going to develop a delirium, those small things are actually really important. Being able to see where you're going and hear what people are saying to you in an environment that you're familiar with are actually very basic but very important things. And as I've already said, making sure that you're keeping your bladder and your bowels working regularly. And if you've got a problem with that, don't be embarrassed about it. Go to the doctor. They've seen it 1,000 times. It can be quite embarrassing for us having to go to the doctor to talk about our bowels and our bladder and things that are personal to us. But to your doctor, to your GP, it's very, very common. It's actually having bowel problems is one of the most common reasons that people go to the doctor. So if you are experiencing problems, don't talk about it. Get it treated and help reduce your risk of getting delirium. Because if you do end up in hospital, sometimes it can be mistaken for dementia because the confusion is very similar. And if it's not recognised straight away that actually this is delirium, the reasons for it can go unnoticed and go and be missed. And then that delirium is not treated. The cause of it is missed and it's not treated, which can then result in it going on for longer. And actually, somebody that's had delirium, they're actually 8 times more likely to go on to develop dementia later on in life. So it's really important that we stop that delirium as soon as it becomes apparent.
So actually, what you mentioned, like if somebody can deal very well with delirium, they actually can prevent future dementia. That is very important message for our viewers. Let's go to Beth again. But can you tell our viewers? We see you have already mentioned some cultural problems among Asian or Black people. They want to look after their family members or a friend at home. So what is your advice how to care for a friend or a relative who has got dementia?
So having a diagnosis of dementia can have a very big impact emotionally and practically on a person. And many people feel like they're losing part of themselves and it can be difficult to adjust to. And each person is going to experience dementia differently. So there's no one set way of supporting someone. So it is best to work things out together. But I do have a few different suggestions that might be useful. So valuing a person and making sure that they're included in decisions, asking their opinion, helping on different matters, such as if you know that they're a good cook, getting them involved in the cooking, asking for their advice on recipes. If they worked in engineering, again asking for their advice on their car and whatnot. Trying to see the world from their perspective. It's going to be scary. If you know you are forgetting things, if you know you're finding it difficult to cope, that is a scary situation to be in. So trying to see the world from their perspective. Practical reminders such as keeping a diary or a to-do list, using calendars and having them up where it is easily seen in the house. Keeping items in the same place, labelling drawers and cupboards, placing important numbers by the phone, and keeping active together, both physically and mentally. So using your physical abilities and being aware as well that abilities might change over time. So not pushing the person into doing something that they don't want to do or can't do anymore, but maybe adapting it so that they can still feel involved. But working together and keeping that person involved in the decisions, because as I said, they may feel like something's been taken away from them.
I think what you have mentioned, engaging the person with activities if they're staying at home, I think this is keep them involved and keep them engaged and actually help them to feel better. And they will feel something like they are inclusive of everyday part. And they will not feel they are not actually looked after by their family members. And sometimes we can see that with somebody delirium, some family members might think, well, if we send our family members to a care home, maybe they are not well looked after. Any kind of message for them? I think, that Asian family ties and all these things, we are actually trying to be like, look after our dearest one with us all the time. Any particular advice for them?
It's a very difficult decision to put anyone into a care home, particularly when you do feel there's an obligation to care. But one thing that I would think about is your relationship with your loved one. If they're at home and you're caring for them, then you're a carer. You're less a daughter, less a husband or a wife. If you do support them into moving into a care home, your relationship becomes a family again. You become that loved one back to them, and the caring role is taken off you. So yes, there may well be an obligation, but an obligation doesn't always mean that you're prepared and ready to take on that role. And having that support of a care home can help you still care for them, but in a family way instead of a more kind of formal way.
Thank you very much. This is as you mentioned, this is a very difficult decision, and our viewers are mostly Bangladeshi. Do you have any particular advice for our viewers who are watching this program and how to look after their dearest one if they have got dementia, or they want to prevent a future dementia for them?
Okay, so as I said, there are some information around reducing your risk factors, but what I want to think about as well is taking care of yourself. If you're looking after someone with dementia, it's important that you do look after yourself. So all of the things that both me and Julie said in caring for people with dementia and reducing your risk factors, if you're looking after someone with dementia, you need to look after yourself. Get to your appointments, going to see your doctor, your dentist, spending time for yourself and looking after your mental health. Because if you're not physically well enough or mentally well enough to look after your loved one, then things are going to get harder for both of you. What I also want to think about is sometimes when someone's got dementia, relatives start thinking about what they're doing and picking up more on, well, have I got dementia? Are these symptoms? And just asking some questions for people to think about. So, have you ever forgotten someone's name or why you've walked into a room? Have you ever had difficulty in getting your words out? Have you ever become lost in a new environment? Have you ever found it hard to make a decision? I'm guessing a lot of people will be saying yes to those. We've all experienced those things. And it's not because the person's got dementia. It might be because they're stressed with the reality of caring for someone. It might be things like tiredness. If the caring role is taking a big impact on that person. Have you eaten? So if you're caring for someone 24/7, have you eaten food that day? Have you had enough to drink? All of these things will impact, and then you might get worried and start thinking you're developing dementia when there are very simple things that we can do there and then to kind of make you feel better, both mentally and physically. We're all human, and we can all experience off days.
Thank you very much. Actually, a very important issue you have addressed. The people who are carer or looking after their friend or relative also need to look after themselves. Otherwise, if you're not looking after yourself, you are actually putting yourself at risk for future dementia. Let's back to Julie again. Julie, can you hear me, Julie?
I can, yes.
Yeah. So, Julie, and we have discussed so many things over the last 45 minutes. Any particular advice for our viewers, how they can prevent delirium, or how can they actually live healthy?
Okay, so one of the things that we use in hospital that can also be used in the community is something called time and space. And we take those letters and we look at individual words. So for time, we have toilet, infection, medication, and electrolytes. Now, the electrolytes is just looking at somebody's bloods and whether or not there's anything abnormal. So we don't need to worry about that too much. But it's making sure that people are able to go to the toilet regularly, checking for whether or not they've got infection, looking at the medications that they're on, asking the doctor to review those. And then so we've got time, we've now got and. The A stands for anxiety and depression. Have you noticed a difference in your loved one lately? Have they become more depressed? Have they had a bereavement or an upset that's causing them to feel anxious? N is for nutrition. So making sure they're eating and drinking well, as we've already said. And D for disorientation. Have they moved house recently? Has things changed in their home environment that's causing them to feel a little bit disorientated? Can we look at that and make sure that they're feeling comfortable? So that's time, and we now have space. S is for sleep. Are their loved ones getting regular sleep? Are they sleeping well, and are they sleeping in the same bed each night? Are they in any pain? Is it something that they need medication for? And A is for alcohol and drugs. And I just want to mention here that sometimes people think that when we talk about drugs, we're talking about illegal drugs. And actually, it's not the case. Very often people can be on medications and the doctor decides to stop those medications. The patient can actually have massive withdrawal effect from some drugs that they've been taking for a long time. Suddenly they're stopped, and the body can go into a withdrawal effect, which can cause delirium. So, if medications are stopped, they need to be stopped slowly and under the guidance of a doctor. C is for constipation. We talk about bowels all the time. Are they managing to open them regularly? And E is for environment. Is everything okay? Is everything normal to them? Are there any changes that are causing them to be confused? By using time and space, we can help minimize the risk and the effects of the delirium. And that can be done at home with loved ones. It doesn't have to be in hospital. But I think that you can search for time and space on the internet. Just put in the word time and space, and that poster will come up, and it will help people understand and remember the things that they need to look for.
Thank you very much for some clear-cut message for our viewers. Any concluding message for our TV3 viewers regarding delirium? In just 30 seconds, you want to say something to our viewers?
Okay, so it's just very important that just because somebody's confused, it doesn't mean it's going to last forever. It's very important to get them seen quickly by a doctor, by a medical practitioner, so that we can find out what's causing the delirium and help reduce it quickly. The sooner we get treated, the sooner we recognise the confusion and that things are not right, the quicker that treatment will happen and the quicker the delirium will settle. By getting it seen and treated quickly, we reduce the risk of it carrying on for a long time.
Thank you very much. Now I'm going back to Beth. Beth, do you have any concluding message for our TV3 viewers?
Yeah, so if I just give you 3 things to take away. So dementia is more than just a forgetfulness, it's more than a memory impairment. Everything that your brain controls can change with dementia. Make changes to your lifestyle now that can help lower your risk of developing dementia, but will also give you a better overall physical and mental health. And if you're worried about yourself or your loved one, please go and ask for help, whether it's your GP, local community centre. Go and ask for some support and advice now.
Thank you very much, viewers. Those who have joined our show today, it's a huge privilege to get advices from Beth Cotton and Julie Wragg. Thank you very much from TV3 Bangla and from Bangladeshi community getting involved with us and advising on dementia, how to look after yourself, how to look after your friend or family members. I think that's kind of a community engagement I think probably it will foster our relation with Bangladeshis, and I think probably from Bangladeshi people who are living in Britain and around the world. And I'm thanking again. Thanks for joining TV3 Bangla show and give proper advice to our viewers. Viewers, we'll be seeing you our regular show every Sunday, same time we start. Thanks very much. Thank you, Julie, and thank you, Beth.
I help my plants to grow. My performance demands competence. Photography is my passion. Accountancy is my profession. We, Mahbub & Co., a team of dedicated professionals.
Mahbub & Co. Accountants.